I think it all started with my family itself, with my parents who were aged. My father was about 94 and my mother was 81. And for my mother, it was a big chore, getting herself dressed up, getting into the car, going to the hospital, wheelchair, and so on. It was a huge exercise for her, more so than for my father. And that really triggered. And I also would say probably it's a kind of a call to serve humanity. Live on Wheels is a mobile healthcare service provider. And we provide nursing care and rehabilitation. Nursing could be as simple as basic nursing, bathing a patient, setting drips, or it could be rehabilitation where a patient requires physiotherapy or somebody had a stroke. We are building a rehab team to include a speech therapist and a clinical psychologist that will complete the rehab team.
Mohan had this idea of starting mobile healthcare services. Of course, when he was putting the team together, and there was me looking for something different to do, something that was close to my heart, and when he ran it by me, that was it.
I spent half my life working in a bank, which is in Malaysia, and after that I left the bank to get into the oil and gas industry, where I was there for a good number of years as well. And healthcare is something new. I'm not a doctor, but I'm guided by a team, by an advisory board who basically advises me on legal issues, medical issues, and whatever is happening in the medical fraternity.
Working in a hospital, what I realized is we've got everything running smoothly as long as the patient is within the confines of that facility. The minute the patient gets discharged or is sent out, you lose hold of it. You've got your wonderful care plan, you've got everything planned out, but it still takes, like they say, it's really about two of us tangoing, and if the patient doesn't come back to you, you don't get to achieve what you want with the patient. So one of the things that really attracted within this sphere of doing what we do in Love on Wheels is that it's because we get to reach out to practically one and all.
Obviously, public hospitals in Malaysia, we know, have about 33,000 beds available, and that's the huge challenge. When you look at numbers of 2 million people coming for admission on an annual basis, it's God's magic how this is all working. And obviously, providing mobile healthcare services, providing services at home is a definite solution. And this is not something new. We don't have to reinvent the wheel. It's being already used in several countries, developed nations. In Malaysia, moving towards 2020, this is something we need to address. And I believe strongly that the government will definitely take on that responsibility.
What we've had to do was take basic healthcare services that most people know about and tailor it or customize it to a way that people can relate to. So if you ask us what's special about Love on Wheels, I think it's the fact that we've got a very creative team. We don't sort of veer away from the clinical practices, but we've tried to deliver clinical practices in a creative way that people can relate to.
Here was a situation. We were looking at a family which the patient was 95 years old. His wife was 81 years old and had a son who was 64. And the challenge for them was mobility. So with us coming on board to provide that service, there was so much of relief for the family. The stress was taken off the family. The joy on the face, the happiness on the face it's the greatest satisfaction and the greatest fulfillment for us, for me and our team. And that is what we are continuously trying to do. This is where we are standing out.
The qualities we look for in our clinical personnel, I mean, it would really have to be passion and commitment to what they're trained for. One of the things that we face is we have them in terms of quantity these days, but we find that the quality could be lacking. We've realized that if they come with the passion and commitment to what they're qualified in, then we need to just mold them to be able to anticipate what you need to change, what you need to do in your delivery system. And sometimes it is about being able to present it to them in the fashion that they can relate to understand that that's what they need.
Live on Wheels is serving the public. We have got into corporates in Malaysia who have engaged us to provide as part of the employee benefit program, so that we can even go to their offices to provide some of the services. And that's something new, and that's something really exciting. Exciting not only for the patient, but exciting for us too and for our team. Our plan is to be nationwide by 2013, 2014. We plan to ride on the current infrastructure public sector infrastructure that is already there. If I had it my way, I will ensure that every Malaysian will have this service available at their home. With government taking a major role, government providing the funds for those who can't afford it, especially the aged, the challenged children who have autism and so on, where the government comes in and takes full ownership and provide this service. And that will be the day. We'll have a party when that happens.